Good morning, Illini. Welcome back to Healthy Illini Podcast. I'm your host, as always, Matt Schrock, and we're glad you're here with us. We are in the spring semester here, 2025, which is kind of wild. It's been 4 years since we started this podcast. If you're new to us, we are glad you're here. If you've been with us for a while, we're grateful that you've been with us for a while. But today we're continuing on in a series that we've been doing periodically over the last year and a half or so about healthcare careers. And so I'm excited to talk to our guests today. I'm joined today by two members of our lab here at McKinley. First up is Ryan Filiaw. He is the lab manager. Ryan, thanks for being here.
Thanks for having me.
And I'm also joined by Jennifer Glass, a phlebotomist with the lab. Jen, thanks for being here.
Well, thank you.
I'm excited to have you both on here because, for one, we are really blessed here at McKinley. We talk about doing healthcare careers and things that happen in the building, and in talking to people all around the country and other college campuses, it is rare for a health center to have a lab attached in the building without a hospital system somehow connected to it. And so we're really blessed to have it here, and so I'm grateful for the things that you both do. But then you have students who come in and they know the word lab, but they don't really know what that means. I mean, I don't know that I knew what that meant before I started working at McKinley. So I really want to talk about what a lab is. And like, I know people know they come to the lab to get tests, but that's about all they know. So let's start off with Ryan as a lab manager, Jen as a phlebotomist. Would you just share a little bit about what your job means and kind of what you do in your day?
Well, so yeah, if you want to talk about the labs kind of broken down into sections, you start with the phlebotomist, so I'll let Jen speak more to what that entails exactly, but as most people know, you come and get your blood drawn, and then after that, that's when the medical technologists, so people that I oversee as well as myself, will perform the test. So we do all sorts of different testing. Each lab is kind of unique in that, you'll have different tests are offered in different places, but generally broken down into departments based on the category of testing that's being performed. So here at McKinley, we have several departments: hematology, clinical chemistry, microbiology, and molecular testing are the distinctions that we have. So then, each of those departments will perform the appropriate testing. So depends on what your doctor's ordering, what's going on with you. That is going to determine where your specimen gets sent.
And as the phlebotomy part, tests are a lot of things. We collect urine, we collect blood, we do chlamydia swabs, that can be any mouth, rectum, vaginal.
Any fluid or
any
swab.
Fluids can be swabbed.
Anywhere you could be swabbed. We've seen it.
We've seen it. And we do strep testing. And so when people say test and lab, that means nothing to us because we need to know. And when students come and they say it's just a general lab, in all honesty, there's no such thing as a general lab, because what's general for you is not general for somebody else. The reason they're here, as a phlebotomist, my job is to tell them, you're here for urine, blood. We can't tell them what they're here for because we don't know.
Sure.
Privacy. I know what I'm drawing, so they can be confident that I can look at your test and know that it's going to go in the right tubes in the right department, and it's going to be tested appropriately. But what I can't do is tell you why you're here, because I have no idea.
And we're a large campus with a large student body, so we have a very busy lab. How many, this is not a hard number, I'm not holding you to this, but just on a guesstimate, how many patients do you see as a phlebotomist, in a day?
Yesterday I counted my labels and I drew 53.
And how many phlebotomists do we have at a time?
Yesterday we had 3.
I was going to say, so you're not the only one doing this.
I'm not the only one.
So,
no.
If somebody's listening to this and they're looking for a job that is, you don't sit around much, that's...
A phlebotomist will never go away, ever.
Yeah. It's a really an opportunity to do a lot of diverse things within one role, and to see a lot of different people. It's just very fast paced. I mean, I know when I come down to drop something off, there's always stuff happening in the lab, and everybody's busy with something, and it's a very energetic, I guess is the best way to put it, position to be in, because you're on the go the entire time.
Yeah, and unlike probably the other building, X-ray and pharmacists are probably the only other place in the building that are as busy as we are, because we've got all of the providers coming to one place.
Sure.
From all over the building, not just checking into West One. They're all coming from those floors. Plus,
outside
people that aren't even seeing McKinley doctors. We do outside orders as well. And all of the athletes. I don't think that people are aware that the athletes get drawn 2 or 3 times a year. So if you ever come to the lab and you look like we're slow, trust and believe we probably just sat down for 30 seconds.
And you're very busy with your fingers on the computer.
That's right.
Putting in the information you just got. Ryan, you mentioned that that every lab's a little bit different. And they do something a little bit different. So when I say a healthcare career in phlebotomy or in lab or anything like that, we're talking about the very small subset that we do here. But in general, what other opportunities are there for, like, as a phlebotomist? Like, what areas can you go to? I mean, most times you think hospital, but there's other things too that you can get into as far as taking this career and taking you somewhere.
Yeah. There's all sorts of things like research. I know people that have done research with lab degrees. But typically hospitals or medical facilities are generally the places where you're going to see the best pay and you're most likely to see more jobs there. It is unusual, like for McKinley, for me to get a job at McKinley was kind of rare. We don't have, a lot of openings here. There's not a lot of turnover, whereas in hospitals, it's not that hard to find a job at a hospital. So I feel very fortunate to have ended up where I've ended up. But yeah, there's all sorts of jobs in all places that I don't even think about. Blood centers, use both phlebotomists and med techs. And so that, depending on what you want to do, totally different genres of the type of work that you're doing.
Yeah, and as a phlebotomist, you have clinical settings like McKinley is. You have hospital settings. There's positions that just do nursing homes. There are plasma donations. And then you can be a traveling phlebotomist that you go into houses and you perform physicals for insurance, but you have to be a phlebotomist to be able to do that. And so there's so many things you can do. The thing that phlebotomists don't do is make a lot of money. that and it doesn't matter if it's here at McKinley, in a hospital setting, in the medical world. Phlebotomy is the very bottom. Why that is because the mindset is everyone thinks that anybody can do it. It's true. Anybody can do it. But not everybody's good at it.
Or should do it.
Because there takes skill, compassion. It takes a lot of things to deal with that. So for what you deal with and all the positions that there are, phlebotomy will never go away because physicians can't provide medication, surgeries. They can't do anything without blood. The difference between getting somebody off the street and somebody that knows what they're doing is the technologist, which is what Ryan is, they can only test the sample that is good as it was collected. So it starts with us from the very beginning. So when you're good and you have a good phlebotomist, make sure you tell them they did a great job, because it's going to be hard to find in a lot of places because, like Ryan said, the turnover is so bad. Not here at McKinley, but in the hospitals, it's really bad.
Well, and you mentioned that anybody can do it, quote unquote, but that's going to lead me to my next question is I don't want just anybody taking my blood. I want someone who's been trained and knows. So what's the education for, like, if you're looking at a lab degree or a phlebotomy, what's the education if someone's listening and they kind of want to look into the field or maybe get in the field? What's their steps?
For phlebotomy, you can take a class. Most of them are 9 weeks. And then you'll have to work somewhere, a hospital or whatever, get a position after that. Things have changed now. I've been doing it for 32 years now. And when I did it, I got godfathered in, so you don't have to test. Now, when you get your phlebotomy certification, you have to do hours, CMTs,
CMEs,
CMEs,
yeah,
hours.
continuing education.
And but here at McKinley, it doesn't require a certification. Other places, when I first started, you had to have a certification. That they took that away now, but at the hospitals, the difference being certified and not is a matter of pay. So, the 9-week course, but honestly, phlebotomy is one of those things that you cannot read in a book.
Mm-hmm.
The more you do it, the better you get.
Yeah.
The better you get, the more. So you can learn from the book what the inside the tubes are, how to spin it, but until you actually start putting a needle in someone's arm, unfortunately, practice makes perfect.
Yeah.
You have to have some guinea pigs, unfortunately.
Yes, you do.
For lab tech, Ryan, what's that path?
There's quite a few things. It depends on how in the weeds you want to get about it, but there's two-year versions, so associate's degrees versions. There's 4-year degree versions, and then there's additional certifications on top of the degrees themselves that typically institutions will require before you are going to be able to be employed. And Jen and I were just talking. I knew somebody that had gone through their entire 4-year degree program, but unfortunately didn't pass their certification exam. She took it 3 times. The hospital we were working at the time had to let her go because she couldn't pass the exam. So for us, passing that exam and being like a licensed professional is pretty much essential for part of the job if you're going to be in a clinical setting. I think in research settings they're a little bit more flexible because you're not necessarily working directly with patients, but the standards are pretty high for med techs. But for me, I went to get my bachelor's specifically in clinical lab science at a 4-year institution. So to my knowledge, unfortunately, U of I in Urbana-Champaign doesn't offer that specific degree program. But I was at U of I in Springfield, and they did. So that's where I got my bachelor's. But if you did have a bachelor's in, say, biology, which I've known several people that have done this, there's a way that you can go back and do like a 1-year program after the fact. But you just have to have that science basics correct.
And for people who don't know what an actual med tech is, that's what they are on CSI.
Yeah, I almost forgot about there's the forensics aspect too. That's kind of similar to McKinley, and like there's not a lot of turnover for forensics people. So typically when you get into that role, I know a lot of people they don't leave. So so if you want to do forensics, it's a good field for that. But at the same time, you might want to be realistic and
there's not a need for phlebotomy in the forensic side, not at all. And
they're dead, I guess. So.
Yeah, and I forgot to mention my path. I didn't go to school. I got hired at Carl way back when they trained on the job. And so I had to train, and I couldn't take my phlebotomy certification test until I had 1,000 sticks. So not that, it took a while to get 1,000 sticks, but you learned a lot.
Yeah.
And then the test is a 400 question test. You wouldn't think phlebotomist would be, but like... One of our questions on the test was, you walk into a pregnant woman's room, you have to draw blood, she's eating a candy bar, what do you do? Normal people would not know that answer. Well, pregnant women, chocolate's full of magnesium. If they're eating that chocolate bar, that doctor is either trying to stop their contractions or they're trying to raise their contractions. So them eating a candy bar makes all the difference in your test.
Yep.
Those are things people don't know, and that's one of the questions on your test. So if you get certified, you got to be kind of smart to take the test.
Yeah. And too, for me, like I started in biology when I first got into college because I didn't ever knew med techs were a thing. I didn't, you don't really get much exposure to that. But I just, for me, observed, I like doing stuff in the lab, like the lab sections of the science courses I was taking. And so I was like, is there something that I can do where it's just that? So clinical lab science ended up being the best fit for me because you're doing hands-on stuff all the time. It's much more involved than like just sitting at a computer all day. So,
and that's one of the reasons I love doing this series is you don't know what you don't know, right? And I came from a very small high school. I love my high school. I'm very proud of it. My kids are going to the same school. And I got a great education there. But I remember my first semester here at U of I, and there were so many things I'd never even experienced. I was like, from like an academic side, right? Some options there. And I don't care what school you go to. I don't care if you go to the best school in the country. There are still things you don't know exist job-wise. And so this gives an opportunity for me to shed light on some of these things, like what it means to work in a lab, what it means to work on radiology. We've done a number of places here in McKinley. But it just kind of opens the door for people to see things they didn't see before. I was going to ask if you always wanted to be a lab tech, and very clearly you did not.
No, I did. Like I said, I didn't know it existed.
It's hard to want to be something you don't know.
Dang,
is there.
I wish there was something that I could just be in the lab all the time and just do that. And I guess there was, so it worked out.
Yeah, and I never wanted to be a phlebotomist. I wanted to be a nurse. And then when they trained me on the job, I planned on going to school to finish nursing degree. But once I got I'm like, heck, I don't want to be a nurse. I like being with these students in and out, in and out, in and out, instead of being, so I love phlebotomy. I no longer want to be a nurse.
And I think that, a lot of people, when they think of healthcare, they're like, oh, you're a nurse or a doctor. And, you've had a chance to interview quite a different fields that are in that realm. I think lab is another good one where there are ways to interact with patients, and there are plenty of jobs where you're not interacting with patients at all, but you're still like contributing to their overall, health and well-being. So I think it's a good field for maybe you're not a people person. So,
yeah, there's a lot of behind the scenes in the lab.
It's always interesting when I talk to students about McKinley because they don't realize that we have almost 200 employees. We're considered, some people consider us a small clinic, but we're 200 employees strong. There's a lot of pieces and a lot of working parts that go into healthcare and go into taking care of people and keeping them safe. So, before we close, I do want to have one other aspect though, because I've talked about it on other episodes that it can be we go places and we see like the waiter at the restaurant you see every time, or even the guy at the gas station who's always there, and we have this mentality that that's kind of where they exist. There's a commercial out right now about one of the phone or the bank companies, and the bank guy lives at the bank kind of thing, and that's kind of like the idea we have for people. We see where we see them, that's the only place they exist. Y'all are more than the jobs you do here at McKinley. So I want to give you an opportunity to share a little bit about who you are outside of that. What's something that you're passionate about, or maybe a hobby or whatever, that it has nothing to do with the job you do here, but is a piece of who you are.
Well, for me, I'm a power lifter. I've won world competitions in my federation. I have a 3-year-old, soon to be 4 grandbaby that I spend all my time with. I like to go fishing, and when I leave here, McKinley so far, I am at home with my family. We cook, we fish, and I love vacationing. So there's a lot of things to do besides McKinley. But when I'm at McKinley, I really love my job, but I really love the weekends better.
Yeah, I don't disagree. For me, I don't have a grandbaby, but a lot of the similar stuff. I like exercising. I'm a runner. I guess I can say that now. I've ran so many miles. I don't know what the threshold is.
More than me, so you can't.
Yes, I'm sure. But I love running around campus. It's really a good chance to see it. And since I didn't go to school here, it's kind of another way for me to connect with the campus besides just being stuck in this building. But outside of that, I also like to learn how to design video games. So I kind of practice learning the software Unreal Engine. So that's fun for me. Kind of troubleshooting that is really fun. I have animals at home that I hang out with. So 3 cats and a dog. So it's a fairly full household. And then also, of course, vacationing, planning a trip to Cancun. So that'll be fun. Yeah. So all sorts of stuff.
And I just like having that little insight because, again, we don't see people outside of these walls, and everybody has interest. And everybody I've asked has always had something interesting that I'm like, I did not know that. I've worked Jen for a decade now, and I did not know some of those things. It's always that nice side to see people because we are more than one dimensional, right? Yeah. And our students are more than one dimensional, so we try and approach them that same way. And it's just nice to have that little side insight into it.
Yeah, and I mean it too. Like, I think the lab gets kind of a reputation for people that don't necessarily want to interact with people. I don't think that that's true, especially at McKinley. I find that most of the folks I work with love interacting with students and love interacting with people, and that's a highlight of their day.
Yeah, and they think the lab's a scary place. McKinley shouldn't be scary. We're good guys.
And, you know, sometimes, though, the thought of they don't interact. I don't know how you interact with anybody with 50 patients in a day.
Yes,
Get the sticks. But I know you're good at it.
We're not getting to know each other well.
But I know you're good at it. I've seen you and I've seen you interact. I know you're good at it. But, guys, I appreciate you taking the time and talking about the lab today and just kind of sharing an insight into that corner of your world and also the corner of career possibilities there. So thank you so much for being here. I really appreciate it.
Yeah.
Thank you.
Yep, thanks for having me.
There are a lot of healthcare careers in the world, but there's also a lot here at McKinley. And if you've heard something and you're like, you know, that sounds interesting, I want to know more, please reach out. Contact us. We'd be happy to talk to you. We'd be happy to have those conversations, get you in contact with somebody if you have more questions, that sort of thing, because there are a lot of careers out there, and lab has a lot of possibilities within it. So we'd love to talk to you about it and maybe help you along that journey if that's the path you choose. But thank you for joining us today. You are on a personal journey no matter where you are in it. You are important and you matter. Your health and wellness are important and matter, and we're here to keep you well to excel. So go have a great week, Illini. Let us know how you're doing, and we'll catch you next time on Healthy Illini.